So as we look at this column, which represents the excursion, we see a 5-degree increase in trunk lean, forward trunk lean. We see a loss of some hip flexion, and we see a nice gain in knee and ankle range of motion. So when we see that increase in range, that represents energy being absorbed at that joint. This would definitely fall under the quad dominant or knee strategy. So we're thinking we're loading up the quad and patella a little bit more in this specific example of Gait versus the hip and the glute max. As we look down here in some of these loading areas, we're seeing trunk lean is nice. We don't have necessarily Gait normative values for running, but we do know that we want to, if this athlete is feeling some anterior knee pain or Achilles pain, if we can pull that knee and hip a little bit posterior, we can offload stress at the anterior knee and then down here at the posterior ankle. When we look at all of these measures and we think about what we need to do to correct some of these patterns, we want to go back to basics. Full hip range of motion, full knee range of motion, full ankle range of motion. Without that, we're going to really struggle to make movement patterning changes. Body is absolutely designed to have full range of motion, instant access whenever it needs it. Body's always going to take the path of least resistance. So if we skip forward to push off and flight phase, in this athlete, like most runners, we can see a little bit of anterior pelvic tilt here as the hip moves into extension. And that's where we can link back to having full hip extension. If you don't have instant access to 15 degrees of hip extension, we'll often see that excessive anterior pelvic tilt can increase lumbar lordosis, and then as we move through to the next phase, can make it difficult for the glute to remain active when we get into initial contact. Certainly, the faster you run, you're going to see some lumbar spine extension and or anterior pelvic tilt, but we want to ensure that the hip mobility is there in the first place. So when we talk about more excursion here at the knee from initial contact to peak knee flexion, we see a 19-degree change. That's great.